the next half an hour that we're going to have with Dr. Nene is going to be him switching a couple of hats. The first hat is going to be him as a doctor. The second hat is going to be him as an entrepreneur. And the third hat is going to be him as an investor. Dr. Nene, can we probably get started with your quick thoughts on this entire post-COVID era and primarily the gaps that you see in the Indian healthcare ecosystem, and what out of those are potentially opportunities for a lot of startups here to address?
So I think it's a great question because fundamentally, before COVID, the medical establishment here and abroad was pushing against telemedicine and some of the remote processes. COVID has forced us to reimagine that. And I would say for all the entrepreneurs in the audience, you have to rethink what health means to you. And in doing that, you figure out what problems are there. Are they problems of access? Are they problems of affordability? Are they problems of infrastructure? These are all pertinent. But I think the real opportunity now is to take healthcare front and center to everyone. Now, practicing as a cardiac surgeon, it's not something I can do very easily over the internet. Having said that, I was a robotic surgeon, so I could operate from a remote station with a robot doing the actual surgery. And that was designed actually originally for the Army in the 1980s with the Da Vinci robots. And then they evolved to letting us do it through minimally invasive things. But I don't see that as being the real focus right now. I think instead what we can offer and what people should be looking at is how can we remotely diagnose and treat people? And then at the same time, from acute care, how can we move one step backwards to giving people prevention, early recognition, and early treatment? And I think those principles long-term will allow us to move much faster because ultimately, when you're born, you don't come with an owner's manual. And the bottom line is every individual is different. And so what I envision is an approach where you have personalized precision healthcare. And I'm not just talking about drugs aimed at specific genomes. What I'm talking about is that if you can create a path for each individual patient, which is separate from everyone else, and walk in their shoes to understand what they go through every day to get to wherever they want to go, then you can change the way medicine is practiced. How do you do that? I think the opportunities are boundless. On the one side, there is education and awareness. I think much of what we see in heart disease and diabetes and some of the other chronic medical ailments is a matter of not understanding the disease. But even now, right, every single day you come up with a headline and it comes over social media and everyone runs. And the bottom line is there's not one source of great evidence-based international standards for all people. And it shouldn't matter if you're rich or poor or in the middle. The point is everyone should get the same care. The second thing is, how do you then create something which is exclusive to the patient? Because as I see it, the patient should be the center of the universe which we create, and we should be the activators. And the real gap, as I see it, is between the patient or the consumer of medicine and the medical establishment. And what we seek to do is kind of fill that gap by giving the patient a bat utility belt, if you will, or an angel on their shoulder or a doctor in their pocket. And it's not just about now, them coming in for a cough or cold. It's about long-term management solutions, which essentially change how they behave, what they need to be aware of, and what they need to do. And it combines a combination of IoT suites, smart services marketplaces, EMRs in the cloud with AI, and then a media package which educates them.
What I'm going to do, Dr. Nene, is dive a bit deeper here with your entrepreneur hat, right? What challenges do you see, as entrepreneurs while building for some of these gaps?
So I look at it as global as well as Indian challenges, right? In India, as everyone knows, we have 1.33 billion people. 70% are in the rural areas, 30% are in the metro areas. Our overall spend on healthcare is only about 4%, of which 1 1 to 1.5% is governmental, 65% is borne by the private sector. That'll change, as one of our speakers pointed out. But for now, I think access to care, affordability, and infrastructure are really big problems. From the entrepreneur's angle, how do you get the funding? What is the life cycle? What is the long-term value? How do you get people to take what you're selling and actually take it to heart? And what I think is it has to be simple. When I was a heart surgeon and I practiced for 20 years, I looked at it very, very simply, that I treated my patient as if they were family. And I said I would give them the same care that I would give my own family. It made it easy deciding what's right and wrong. What we have to do is build products which add inherent value to every patient's life. And when they believe in us and they trust us, then they're going to be able to turn around and, use our products. And when we, repeat that cycle again and again, they will do it. So let's go through specifics now, right? Whether it's on the convergence scene and you're talking about appointment making, access to doctors, all that, I think telemedicine can offset some of that and act as a triage center. And there's been several ideas floated now, and I think a lot of people can get access to the basic level of care. In emergencies and all that, I would say designing dashboards which keep track of where care can be rendered and at what level, and also outcomes-based metrics. In the US, this was famous. They would rate you as a doctor not on what a patient felt about you, but on your actual outcomes. And in fact, they reported this publicly. Imagine that. It's not like an Amazon review for a verified buyer, but it's something which is recorded. It doesn't force you to not take on high-risk cases, because that could happen. But the idea is, if the public knew that all the outcomes were the same and that the care they were getting was optimal and the same every single time, same medications, same pathways, and there are evidence-based approaches like that, then it would change the trust factor, right? There wouldn't be a lot of going back and forth. What are the hurdles you face as an entrepreneur and I face as an entrepreneur? The first one is getting the teams we need. I'll tell you, some of the MNCs have sucked up a lot of the great teams because they're willing to spend any amount of money to get them. And then at the same time, getting them to be aligned and getting them the tools. For hardware in particular, it's very hard in India to get the hardware support you need. Software, we're a world leader. I mean, you take an Indian, you put them anywhere on the planet, they produce software, and we've been outsourcing for years. When I spoke at NASCOM, it became very clear that the paradigm has shifted, that we're now trying to serve our own indigenous population, and it's growing at a very fast pace. The third thing is changing the mindset on investments. When I first came into the entrepreneur sector, it was very hard to convince native investment groups of the long-term future. I joked about it and I said that Facebook would never have survived here because no one would have a 10 or 12 year lifespan and have that kind of view just on the basis of traction with no revenue, right? And so I think it's important to have a business model, but sometimes it's very hard to reinvent and be explosive and revolutionary, not just evolutionary, without figuring out the business model later. And I think in India, we're often focused on that in terms of investment. I think we need to get out of that. I think we need to have a broader approach. And it's like the journey to the moon. Along the way, you're going to invent a number of different things, and you have to enjoy the serendipity of that journey as well as that. The last thing is having a community. I love what Headstart's doing. I love what the incubators are doing. And we need to be collegial about it. In the Bay Area, in the Silicon Valley, where I went to pitch, a lot of these guys were much more collegial about it. They knew what you were going through. And the angel community was huge. Whether it's, some of the innovation think tanks, some of the other things, we've got some of them in India now, and it's growing. I've worked with the MIT, IIT REDX program. I've worked with iSpirits Foundation. I've worked with other people. There are some great people, a lot of who have come back and some who are native. And so I think there's opportunities, but I think going forward, all of these things have to come together to help the Indus entrepreneur, if you will. And, speaking at TiECon, speaking at all of this, you get an appreciation for the fact that people do want to do that. The last thing I'm going to say is don't just build for India. Have a global mindset, because healthcare is not one problem. it's a global problem. And I think there's an opportunity there to create something which is used. Maybe the skin will be a little different, but the fundamental problem is the same, right? Heart disease is heart disease, no matter what you say. Diabetes is whatever it is in India. We may have a higher rate of it, but the idea is solve for India, but export it to the world, and you might find another business model at the same time.
My question to you there is, if you can wear your investor hat, right? Because you've also been a very active investor. And in fact, one of the popular startups has been Goki, right? And can I probably connect what you just said before this with what you are going to be talking as an investor in terms of wearables and community, right? A lot of points that you just mentioned in terms of hardware, in terms of enabling the doctor side and the patient side, plus building a community of sorts. Are we seeing glimpses of that in your investments as well?
Whether it's in the devices space or in the services space, what I say is they all have to be linked, and they all have to come back to a center point, which is serving the patient's best interest, right? You cannot build a hammer which goes for one nail. You have to build something which goes for all nails. And the key is that you have to be focused on the area of expertise you're in, but at the same time, you have to be able to solve these complex problems. So when I look at this from an investor standpoint, these are the key points which I'm taking home when I'm assessing it. Obviously, you do a domain knowledge kind of exercise, looking at who else is in the space. You see how many other startups have tried to conquer this. You also see the financials that can you scale this, right? And make it sustainable. In some cases, it's a great problem to solve, but it's not scalable. It's not something which you can solve, which would make a huge difference, even though it may be for that founder. And so these are things, maybe you can bring them into another part of another startup and bring it together.
Absolutely. I think I'm just going to add something to the point that you made in terms of try visualizing and build for the connected ecosystem. Right? So that is a beautiful word that you mentioned in terms of thinking of the doctors, the caregivers, the patients, the hospitals, the insurers, the government, right? All these players that you need to build keeping in mind, right? And even if one or two of those players that you don't think of while you build for a particular stakeholder, your entire plan could go wrong. Because like you said, the future is about building for this connected ecosystem. What do you see, in a startup before investing in them? What excites you? Yeah.
You are always looking at four different things, and this is classic business school, but you're looking at the idea, the fundamental idea or the gap or the problem which they're addressing. And I think Vikram made this point, if I'm not mistaken, but he said that, look for the problem. Don't worry about the process. Don't worry about the capitalization. Don't worry about how much you're going to make. What you're trying to do is solve a problem fundamentally. The second thing is think about the leader or the team. And you have to have people who are immensely passionate, but also have the wherewithal to figure things out. I'm not necessarily thinking that they have to be from healthcare. That's the crazy part. I've got a lot of background in this, and I understand the fundamental challenges which patients and doctors face. But at the same time, what we realize, and speaking at Google at a similar fireside chat, Google doesn't hire just technologists. They hire from all over. And what that adds in my team at R&M is that I get a very broad-based approach. So that was the next step. The third step is the process. How do they apply their fundamental idea and then the solution they're doing with the team they have and build something, either hardware or software, to basically take care of the problem. More importantly, how do they pivot? How do they figure out when they come against obstacles, whether it be financial or whether it be failures? And believe me, failures you learn from just as much as you do successes. And then the last thing is the lag in financials. Most of the startups, at least the early stage, will not have those. And so you're making a bet on someone who you will be in. And as a mentor, you have to be able to bring them forward through your networks and through your idea spaces and try to inspire them to do more. And if I could say just one thing that people have to believe in themselves. If there's an idea, it may come from their own personal background where they have something go wrong in healthcare, or it might be from something they've observed in society. And there's many of them right now. So this is how I look at that.
But I'm going to end it with a very interesting point here, because I feel it's also very important to address this. And it's going to be interesting hearing this from a cardiovascular surgeon, but also who's been an investor in the healthcare space. This is something that Dr. Vikram also mentioned in terms of the entire mental health space seeing a lot of boom, right? For the right or wrong reasons. The lockdown has also, in a way, ensured that 1 billion people have all become, participants of Big Boss, right, in their own way. So this is definitely leading to a lot of, issues around mental health in different forms for different people. How do you see it, A, as a doctor, and B, as an entrepreneur in this space?
So I think it's a great point. Look, when I practiced, I would say half the healing's up here, the other half is down here. Because even if you fix someone medically, if they didn't buy into the solution and weren't part of it, they could not get better. Now, fast forward into what we've gone into, mental health has a tremendous stigma in India as well as in the world. And yet we see all kinds of catastrophic results from that. You look at IITs and you look at the suicide rate, you look at things like that. The problem is we need to recognize that the mind is just another organ, and that it is actually a medical disease of neurotransmitters and other things, but also to some degree, it's of talking with people. And it becomes very difficult. I think this is an amazing opportunity. And in our systems, interestingly, our relationship managers are psychologists. And so that kind of gears you to building expectations and goal management, because then at the end of it, your life is all about that, whether it's at your work or whether it's at home or whether it's everything else. It's the expectations you set. Now, moving forward, I think there are certain things which are amenable to telemedicine much better than others, right? Physical domains where you can examine, yes, you can create a one lead telemedicine EKG, but sometimes you have to lay hands on someone and examine them. Further, if you need to intervene and do a procedure, you definitely need to, right? But things which are initial triage or mental health or dermatology or some of the other things, and also the educational part. I mean, look, how many times have you gone to the doctor's office where they speak to you for 5 minutes, write a little chitty and send you out the door? How is that going to change prevention for you getting the same thing again when they've never explained to you? They didn't have the time. They had 80 people in their office that day, and it's not their fault, right? There's only 1.6 million to 1.8 million doctors, of which 1 million are allopaths in India for a population of 1.33 billion, and only 2% of the MBBSs go to the rural areas. So there's a huge mismatch here. And so whether it's mental health or it's some of these other things, mental health right now is one of those that we can attack very, very clearly without a stigma. Imagine you can log on anonymously or log on discreetly without anyone else knowing that you're walking into a therapist's office or a psychiatrist. The second point to make, which is a great one, if you look at the best athletes, the best actors, the best producers, to go from 90 to 100%, they often had a mental strength coach. You can call him a success coach, right? Because sometimes you need to decode the issues which you face either in your childhood or along your things, and there are better structures. So I think this is a huge area for potential, startups to focus on, whatever they do, right? In kind of A, setting the expectations properly, B, giving people a success coach, I call them, right? And having them kind of design things which will allow them to go to 100% productivity and make them have happier, better, longer lives and more fruitful lives.
Absolutely, Nene. In fact, there are a couple of points, Dr. Nene, that I wanted to highlight, because I think while we summarize and end this session, that's very important to take home. In fact, if I may quote you and say, mind is just, or solving for the mind is just like solving for another organ, right? and just like how you would solve for the heart, you're going to be solving for the mind. But as an entrepreneur, you have to look at it as a connected ecosystem again, irrespective of whether you're building or solving for a heart problem or whether it's diabetes or whether it's for the mind. You have to continue to look at the various stakeholders that exist there, right? And the other thing that I also wanted to highlight here is at any point, do not stop looking at the various stakeholders that you're solving for. I think that's a very, very important point that you emphasized a couple of times during our conversation here today. And finally, if I may talk about in terms of the investment angle, it is totally fine. And there are angels who are looking at investing at an early stage, but you as a team need to have total clarity on what you're trying to solve for, right? And that's something that the investors look out, because it's you who's going to be building the company, not them. And it really doesn't matter, whether you had 2 decades or 3 decades of healthcare experience, but as long as you have a good understanding of the problem you're solving and how to solve that. Amazing insights, Dr. Nene. I think this is something that, with the permission of you and the organizing team, we should push it out to a lot more folks who couldn't make it to the session as well, in terms of the insights that came out over the last 2 hours, right? Be it, in the last session, starting off with the entrepreneur's hat and then the investor's hat, and finally touching about, the connected ecosystem. And, the Vibhav's or Dr. Vikram's point on touching on the preventive side, seeing more focus in the coming future. And Vibhav's point on do not forget the government, right? Whatever you do, be it the state government or central government, you may at some point have to, touch base with them, right? So those were beautiful points that we had. And of course, Manish's point, and Ravi's point in terms of also the rural population. Talking about rural, I just wanted to leave the audience with one amazing fact that you gave us, that, that is only one doctor for every 100,000 folks in the rural area, one for every 1,000, population in India, but one for every 100,000 people in the rural area. So that's a very, very big problem or opportunity for entrepreneurs to solve for, right? Thank you so much, Dr. Nene, for joining us today on such a short notice. And I think the best part is a lot of entrepreneurs here on the session today will continue to have a lot more questions. I think all of you can put your questions down on the form that you see on your chat. If there are any unanswered questions, we would definitely ensure we take it forward to Dr. Nene and try, getting it answered for you offline. We would definitely be, writing you guys a mail with a blog post, with our thoughts or our notes of the entire session today. Along with that, we will try getting your questions answered as well. Thank you so much, Dr. Nene.
Thank you. And you did a great job bringing together a very cool panel. And I mean, look at how many people came together with this. I'm inspired because I think if all of us think the same thoughts, there's some opportunities to do some real good. And, the product, if you design perfectly, the byproducts, whatever you want, fame, fortune, this and that. But the key is to build that great product. And I think that, these people are inspiring. So thank you for letting me be a part of this.